So this is my second attempt at this video because the first one looked like this. The IT band, which goes from like your hip down this. So you've been planning this awesome hike for a long time and you're really excited to get out there, but a couple days in your knees start to kill you and you think it's the end of your hike, but maybe it's not. Maybe there's something that can help you. And I'm here to save the day with the Protect Iliotibial Band Wrap. Yeah. So some of you know that followed my hike, I struggled with knee pain for about 2 months before my hike until about 500 miles in. Yeah, 500 miles. It was an obnoxiously annoying thing to deal with, but I kind of wanted to thru-hike, so I dealt with it. But I saw people get off because of the same type of knee pain, but they didn't have anything to help them out with it, and they didn't know if it would go away, so they just called it quits and said thru-hiking is not for them. Their body couldn't take it. But I think that it can. The pain that I had was horrible in my left knee. I would walk sometimes with my knee straight for miles because anytime I bent it and put any pressure on it, it would just kind of sting, but more like a mix between a sting and a throb. So the Protect Iliotibial Band Wrap is a... what is it made of? Let me just read you the Amazon description of this so you can know what it is and what it does. So according to Amazon, how it works: the IT band wrap provides targeted compression, stabilizing the iliotibial band track. In addition, it absorbs stress to the area and reduces friction and rubbing of the femoral condyle. I don't know if that's how to say it, but that's a body part, I think, in your knee. Design theory. The iliotibial band wrap includes a compression pad, which provides effective, targeted compression. It is 2-inch wide, and it is 2-inch wide. I don't think that's how they should write it. They should write it is 2 inches. Okay, it is 2 inches wide and is made from UBL neoprene, which is Velcro compatible and very comfortable on the skin. It's comfortable but not very comfortable. The Velcro right here will hang over the side of the fuzzy Velcro and sometimes rub on your leg. This can be fixed by cutting this little U shape or N shape, whichever one you want to call it, a little bit thinner, so that when it connects to this part of the band, it won't hang over. That was the most annoying thing about it, but I never fixed it. That's a suggestion if you wear one. It's adjustable and stays in place. Those both are very true. It is adjustable and it always stayed put. They have different sizings on there. You can look at it. I think that pretty much anyone would be able to fit into the normal size. So a couple of things that I really liked about this was, number one, I think that it saved my hike. Without this, I don't know that I would have dealt with the pain. There was a lot of people that had the same pain and I didn't see them anymore. Iliotibial band pain is very common. It's an overuse syndrome thing that happens when you walk too much, or it's common among runners when you use your legs too much. When you go from doing nothing to walking every day or running a bunch of miles, and your muscles aren't built up right to hold the iliotibial band in place. What is the iliotibial band, you might ask? It's a tendon, I think, that comes from around your hip. It goes down the outside of your leg, around your kneecap, and connects underneath your knee somewhere. I'm not a doctor, but I just looked up things online. What this does is, with this small padded area, it compresses that band and stops it from rubbing. It makes a huge difference. On Amazon, they are about $17 right now, and I will leave a link in the description. If you use my link, I get a few cents from it, which helps out. It doesn't cost you anything extra to purchase it through my link, but it helps me, so thanks for that. If you're planning to do a thru-hike, I would definitely suggest Googling, YouTubing, searching for all different types of knee pain. Look into running knee pain, look into things that happen when people are cycling, all that kind of stuff. Just look into all these different types of knee pain. Look into ankle pain too, just any type of pain, so that once you are out on trail, you can diagnose what you are feeling and know how to fix that. If you hop off trail and go to a doctor, they will tell you, oh yeah, it's this. They might be right, they might not. Doctors don't always know what they're talking about. They just cost a lot of money. And for sure, the doctor will tell you you need X amount of days or weeks of rest, which sometimes they might say you need to be off your feet for a month. That sort of stops a through hike, which is not true. I mean, I hiked with the pain, dealt with it. It got better after 500 miles. After a quarter of the trail, it got better, but it did get better. Let's see, what else was I going to say? But the more you know about common problems, the better you are to be able to help yourself when you're out there, and your chances are much better to finish your through hike if you know what's happening rather than hearing the bad news from a doctor. So look into as much as you can. So to put this thing on, you'll feel down by your knee around the outside and feel for something that's hard. It's like a tendon, so I mean, if you rub right there, you will feel yours. Depending on how cushy your leg is, it might be harder or it might be easier. You'll want to slide your hand, follow that tendon, follow the iliotibial band up about 2 to 3 inches, and apply the padded part of the wrap to your iliotibial band and wrap it snugly around. You don't want it too tight because it will get uncomfortable, and it doesn't really help more when it's tight than when it's snug. So you just want it snug. You don't want it loose because it'll slide around and it won't hold your iliotibial band in the right spot. But it's surprising how little compression it actually needs to make a difference. Now this thing will not take away all of the pain, but at the end of the day, it's amazing how much less your knees ache. Now if you're feeling knee pain underneath or on the inside of your knees, those are completely different things, and this wrap will not help you. There's other ways you can treat those. I don't know really anything about them because I didn't do that much research on them because I wasn't having issues with them. Another way to reduce pain, of course, is to lighten your backpack. The lighter your pack is, the less your feet will hurt. That's just how it goes. Also, if you weigh more, it's a lot more common for these things to happen. Things like plantar fasciitis and iliotibial band syndrome, once you become more active, if you are overweight, are very common because it's basically like you're carrying a pack all the time and your body's just not used to it. So ways to avoid knee pain without this band: lose weight if you can, lose pack weight if you can. It costs a lot, but it's worth it if you like backpacking. There are a ton of videos on stretches for the iliotibial band and different knee pain stretches that you can look up on YouTube. I won't show you any because there's, I guess, not doctors, but other people who talk about knee pain that have a bunch of videos out. So just check out some of those, look for some stretches, keep them in mind, and have fun on your through hike. Don't be scared of knee pain, just if it happens, deal with it. It sucks, but through hiking is kind of always painful, so it's better to have iliotibial band pain than a broken foot, I guess. I hope this video was helpful to someone. If you have any questions about knee pain, about things that I dealt with while I was hiking, yeah, anything about knee pain, or this band, or stretches, put them in the comments, and I'll get back to you. If you thought this was interesting, hit that like button. If you didn't think it was interesting, you can still hit the like button just for fun. And thank you for watching. You want to watch something cool? This is an old hiking video that I made with my family a long time ago. Check it out. It's interesting. Okay.